friends, it's Aubrey, support specialist and social media platform manager here at Nebraska AIDS Project. And once again, it's my favorite time of day, nap time, a brief break in your day to get all the Nebraska AIDS Project news. And today we're joined once again by one of my favorites, Ashlee. She's joined us today to talk to us a little bit about hepatitis, as May is Hepatitis Awareness Month. So welcome back to Nap Time, Ashlee. How are you?
Thanks so much, Aubrey. I'm excited to be here, and I'm excited to talk about hepatitis because it's a really important subject. And for Hepatitis Awareness Month, I want to make sure that everybody kind of has the ABCs of hepatitis.
Yes.
It's a little confusing.
Because there's so many different varieties of it. It's hard to keep track of.
Yeah.
So I guess let's just start with the basics of hepatitis. What is it, and what are some of the ways it could be contracted?
Absolutely. So hepatitis just means inflammation of the liver. So it's a family of viruses that can attack the liver and cause damage. So there's, for our purposes, hepatitis A, B, and C is what we'll talk about. Hepatitis A is sort of like a foodborne illness or kind of like food poisoning. It's spread fecal to oral. Hepatitis B is sexually transmitted. And then hepatitis C is spread through contact with blood or other bodily fluids that contain blood. We have a vaccine for hepatitis A and hepatitis B, and then we have a cure for hepatitis C, but we don't have a vaccine. And sometimes a person can have an acute or short-term infection, and sometimes it's chronic or long-term where it is doing damage to the liver over time. So it's easy to see how it can be a little confusing. There are also other hepatitis C's that are, in certain situations, if a person has hepatitis B, they could get hepatitis D. But for our purposes, A, B, and C, and especially hepatitis C is really important.
Gotcha. So given the different A, B, and C, are they all screened for the same type of way?
So they're not. So the most important thing I would say for people to remember is check with your healthcare provider, check with your vaccination records, see if you've been vaccinated for hepatitis A and hepatitis B. If not, there's a lot of places that you can get vaccinated, including your healthcare provider, a federally qualified health center like All Care Health Center in Council Bluffs or One World Health Center in Omaha, sometimes Public Health or Free Clinic. I just talked to one of my public health administrators out in Page County. They do the hepatitis B vaccine. So A and B, check in, make sure you've been vaccinated. Hepatitis C is what we need to test for and screen for. And that's a blood test. Sometimes it might be a blood draw, and sometimes it might be a finger poke. And then there can be more testing depending on what a person's result is. But that's the one that we really need to test for is hepatitis C, which is the one that is spread through blood and the one that we don't have a vaccine for, but we do have a cure.
Got you. So the vaccine cure, there's two different, just assigned to whichever hepatitis you might have contracted.
Right.
So if someone were to come test with you, do you then send them up to, like, you connect them to here's where you can get your vaccine, or is that, how does?
Absolutely. So I'll just talk to my clients about, hey, do you know if you've been vaccinated for hepatitis A and hepatitis B? And then if they don't know or they aren't sure, then I'll refer them to go get those vaccines. We're seeing an increase in hepatitis A, like sometimes in people who are experiencing homelessness, maybe because of lack of access to clean water or ways to kind of cook, sanitize, that kind of thing. So definitely that's something that I talk about with folks who are experiencing homelessness. Everybody should be vaccinated for hepatitis B. That's a more common vaccine. It's typically required to get into school, but I tell people just check with your healthcare provider. And then I offer the hepatitis C test. So the hepatitis C test, I encourage for anybody who's ever used injection drugs, even just once. And for baby boomers born between 1945 and 1965, just because of the lack of knowledge that we had about hepatitis C in the 50s and 60s, and giving shots with the same needle, or dentists not wearing gloves, and really anybody. The CDC recommends that everybody should be screened at least once for hepatitis C, but especially those populations, folks who've had a home tattoo or have had a sexual partner with hepatitis C, maybe a household, living with somebody who has hepatitis C. So we'll do the blood test, which checks for antibodies. Then, if the person has antibodies, we need to do further testing and then kind of go from there. If they need to get the cure, we'll talk about, okay, what's transportation look like for this person? What's their insurance situation? What's the best way for them to get access to care? And I'll just work with that person until they feel comfortable and they're connected and they have the doctor and the resources that they need.
Gotcha. So that's really nice. It's like a little personalized. You've got somebody with you the whole way through till you're comfortable with taking the next step.
Yes, a lot of my clients are just in different situations. So being treated for hepatitis C, getting the cure, depends on your insurance, and it depends on where you live and what your access to transportation is. So it's just a little different for everybody. And I want to make sure that people feel comfortable and that they get the care that they need.
Absolutely. So once someone comes in for a screening, how long would it typically take to get those results back?
So the first test that I do just takes 20 minutes. It's just a little stick. Typically I'll stick once and I'll offer an HIV test and a Hep C test right there. HIV will be ready in a minute, the hepatitis C in 20 minutes. And then if that test is reactive, I will do a blood draw, send that off to the lab, and then it usually takes a couple of weeks, sometimes longer, to get those results back. And then we'll just go from there. But that first test, 20 minutes.
Quick. Yeah, that's great. Speaking of testing, where might you be in the future where people could find you to receive a hepatitis test?
Absolutely. Yes, thanks for asking, Audrey. I'm going to look at my phone to make sure that I give the correct information here. So for May, since that is Hepatitis Awareness Month, so I am always at the free clinic in Clarinda. So Nottoway Valley Free Clinic in Clarinda, and that's the first 3 Thursdays of every month. So the first 3 Thursdays of May, and it's at 6 p.m. sharp. And the address for the free clinic is 822 South 17th Street in Clarinda. And I'm sure that we can put that.
Yeah, I'll include that right below in the video.
Okay. Yeah, and if people have questions about the free clinic, they can call 712-542-0702. That's Karen, the coordinator. And the free clinic is great for people who don't have insurance. We do a variety of medical things, but certainly, regardless of anybody's insurance, they can meet me there and do the HIV test, the hepatitis C test, and it's totally free. And of course, they can contact me ahead of time. We'll put my information in the comments, but 712-545-0107. The other place I wanted to mention is that we are doing testing at the food pantry in Red Oak, Iowa.
Okay.
And that is always going to be the second Wednesday of the month, so the second Wednesday of May, and it's in the afternoon. And the food bank is going to be moving soon, the food pantry. So I'm not sure of the exact address quite yet.
Okay.
But folks can just reach out to me, text, call, or email, and then I can let them know where we're going to be. So again, 712-545-0107. But of course, if somebody is somewhere else in Southwest Iowa, they need a hepatitis C test, they need some just information, they can certainly reach out.
Perfect. A lot of information, a lot of good information. We'll have it all listed right below here, so we'll break it all down for you. Ashlee, thank you so much for joining us again. I really appreciate your time and your knowledge. So with that, nap time is officially over. It's time to wake up because you do